organizing bike rides across the country, and of course he has personal motivation for this because he has been suffering from a brain tumor for many years, several surgeries, but now is pretty well. So of course he wants to somehow repay the scientific community, and the best way to do that is by raising money. And also we're chatting just before that Paul is essentially going to be the star of a movie made about his life and his struggle. And the theme is that, when you're diagnosed with a dreadful disease, you don't just give up, you try to make the best of it. And you were saying that Arnold Schwarzenegger was one of the guys that was interested in this, and also you mentioned Lou Ferrigno. And I think I remember him from The Hulk. The Hulk. So how did he get involved?
Well, no, I met him more because he happened to be at that seminar as well. But I didn't. He's not involved in the film as such. It's just more that how would I word it, my relationship with him? He's a very nice guy. But what I've noticed about Lou that was interesting is if you cover your mouth and you talk to him, he has no idea what you're saying because he has to read lips.
Really?
Yeah, he's still legally deaf.
Yeah.
He's got hearing aids, but his hearing is still significantly
And is it
affected.
still large?
It's funny you should say that. Actually, the day that I met him, I weighed 287 and he weighed 285. So I'm heavier than the Incredible Hulk, which is kind of scary.
Because I saw a recent picture of Arnold. Well, Arnold, of course, he was a fantastic bodybuilder and won all those competitions. But the last picture I saw of him was not very flattering in his muscle structure.
Well, he's 67-ish,
Yeah.
66. So how long are you supposed to still have a body fat that's under 10%? You've got to be realistic too.
So he is going to be involved in any way other than your original discussions with him? Or?
As far as Arnold?
Yeah.
What he's done is he's given me legal permission to utilize a portion of his film Kindergarten Cop. I don't know if you've seen that movie, but he plays Detective Kimball. Yeah. And there's a scene where he's teaching these kids, and he says, "I have a headache," and the little boy says, "Maybe you've got a brain tumor." And he says, "It's not a tumor." I don't know if you remember that.
Yeah.
Well, I got a legal document from his lawyers to be allowed to use that for the film. So I use that within my documentary as such.
Oh, yeah, very good. And in terms of just so that people have a little bit of background of what brain tumors are, because it's not very different, and some of course are more dangerous than others.
That's it.
So if you can just give a little bit of a rundown.
Well, there's roughly about 120 brain tumors known at this time, of which some are malignant, some are benign. And when a doctor diagnoses you, they look for, first of all, what kind is it, where it's located. The grade makes a big difference, and they have to determine if it's benign. And benign basically means it's a growth. It's usually sometimes not removable, more often than not a removable growth. Whereas malignant means that it needs to be it's cancerous, and it needs to be it has to definitely be removed. Otherwise, it could spread and finish you off sooner than it otherwise would.
Unfortunately, even benign ones are not necessarily safe. We had one of my colleagues here at CJD, who was an announcer, Mark Rennie, and he was in his early 30s, and he was diagnosed with a brain tumor, and it was benign. And so he thought, well, this is going to be okay. But turned out not to be okay, because even benign tumors will grow. They're not malignant, so they don't spread cancerous tissues. But if they grow, they can do enough damage to the brain just by physical disruption of the brain. And unfortunately, he passed away. I think it was 32 or 33 from a benign tumor.
Well, every year I have I choose a poster child to become sort of the focus of our rides. And last year's was a little boy named Devin Payette, and he's got a kind called neurofibromatosis 2. And it's considered by definition to be benign, but nobody survives it beyond 15 years. And he's now about 10. He got diagnosed at 5, but they keep growing back. And he's had about maybe, I'd say, 7 or 8 tumors that have regrown, and to the point where they had to remove his atlas bone, the top bone in the neck. And he's now blind in one eye, going deaf in one ear. So his quality of life has been affected, but he's nonetheless struggling and keeping on.
Yeah, and unfortunately, nobody knows what causes brain tumors. With many of the other cancers, you get somewhat of a handle on what is causing it. we have an idea that bowel cancer is caused by various kinds of disruptions of the bowel. I mean, like nitrites and processed sweets, etc., are linked, and although there's still some question about how fiber is linked, but it probably is linked somehow. But with the brain tumors, there really is nothing that I've seen that no common link between the different kinds of.
It's still considered idiopathic.
Yeah.
They have no idea what. Some are primary, some are secondary as well, of course, and that plays a role as well.
And I mean, obviously, I follow the cell phone business, and I mean, so much has been written on that. But when you look at all of the data, I just don't see that there's any sort of connection there.
I guess I'm a bit of a conspiracy theorist when it comes to that, because who knows? There was a time.
I mean, nobody really knows.
I still remember, 30, 40 years ago, you'd see medical doctors smoking on TV promoting a cigarette.
Camel.
Right? Yeah, Camel. Whereas now they realize it's not healthy. It took them 30 years to come up with that. So who knows if they're going to come up with the solid evidence.
I mean, you can never say absolute no to anything. But I mean, at this point, to me, really, and I've been looking at all of those studies, I don't think that is there. But anyway, it's obviously it's a very serious kind of a condition, and a lot of research that needs to be done. And chemotherapy has come a long way in brain tumors.
Yeah.
I mean, has really enhanced survival in the last couple of decades, and diagnosis, of course, has come a long way as well. I mean, MRI now can not only help diagnose the brain tumor, but it can pinpoint the size of it exactly, so the surgeon knows exactly what to do. Right? It's all pre-planned. Whereas before we had the diagnostic techniques, before we had the first it was of course the CAT scans and then the MRI, they basically didn't know what they were going to find until they opened it up, right? And now it's you know exactly where to go, and the surgical techniques, of course, have also
improved over the years
a great deal. So there's been progress, but not enough. So anyway, Paul, thanks a lot, and the best of luck, of course, in raising the money. Is there any website where people can get more information?
Well, they can go to my namesake, which is www.drpaulpoirier, POIRIER.com, and there they can see a trailer for the film. It's about a 3-minute trailer, and the whole film will probably, I'm going to set it up down the road, maybe within a year, as to different places that they can maybe watch it or view it. Because we're also, I've been offered to make a French version of it, because I'm friends with Marjo, who's a famous French-Canadian songstress, and she's willing to narrate a French version, which might happen down the road as well, but we're not quite there yet.
Oh, very good. So maybe you're on your way to superstardom.
Hey, you never know, Joe. All I want to know is, when am I getting you on the back of my bike again?
It's going to happen. It's going to happen, as long as you give me a good thick helmet.
I will do so.
Okay, Paul. Thanks very much.
Thanks for having me, Joe.
You're listening to the Dr. Joe Show, CJD.